Guys, so we are here at Williams Health Center with Dr. Boyd, and we just wanted to address an issue that you might have had. I've noticed that there were a couple of people who were struggling with some elbow pain on the inside here, and of course I know this expert in injury prevention and wellness. So I was just asking him, what are some things we can be doing at home? What are exercises or stretches or something? How do we get that better? So what do you think?
All right. Well, thanks, Allie and Dave, for having me. And yeah, again, as Allie said, I'm Dr. Boyd Williams, a local sports chiropractor and supporter of the local CrossFit community. And both Dave and Allie have come to me describing some problems, specifically some elbow and arm problems related to some of your workouts. So today I want to give you kind of some insights as to why that might be happening for some of you, how to modify maybe some of your activities, some self-help tips and things that we do here in the clinic that seem to work very, very well. So my understanding is that with some recent workouts, people are developing problems in the inner portion of the elbow, the medial side of the elbow, is that right? So kind of loosely termed, when there's problems in the inside of the elbow, that can be called golfer's elbow, just where problems like on the opposite side can be called tennis elbow. But in this case, obviously, it's not a golf-related injury.
Yeah,
it's coming from the gym, right? So it's likely that there's problems with maybe a muscle strain. If it's chronic, it's turning into a tendonitis. That there's inflammation in the inside of the soft tissues of the elbow here. And also that because those muscles attached to the bones of the elbow can cause distortions within the elbow joint. So let's take a look at a volunteer here that I brought in. But when we talk about the elbow joint, everybody, we're talking about three bones. We're talking about the humerus, that's the upper arm bone. We're talking about the radius, which is one of the bones from the elbow to the wrist, as well as the ulna bone. When there's muscle strains, activities that might be traumatic or just kind of chronic overuse over time, when the muscles and tendons become inflamed and tense, little by little, that can then cause distortion in the alignment and in the biomechanics of the elbow bones. So on the inside of the elbow, we're talking about this bone right here, the humerus coming down and attaching and articulating with the ulna. This bone can become shifted out of alignment and can cause problems. If it's a muscular problem, things like stretching can be helpful, massaging can be helpful, icing techniques can work quite well, and those are some things that you maybe have gotten advice at the gym or from others, maybe you've tried yourself. But if those activities, the ice, the massage, maybe even wearing like a tennis elbow strap, if those things are not working, there probably then is some additional trouble with alignment in the elbow joint here, as I described, and also quite possibly in the neck. I'm going to refer to some charts over here a little bit and make that connection. So everybody knows that in our neck and in our back, there's these bones that stack up one upon another, the vertebrae, and out from the vertebra come the nerves. So it's vital and important for the health of our muscles, for our strength, for our well-being, even the function of the organs on the inside here, that those vertebrae are straight like that picture shows at the top. So those nerves can get out and the messages and signals can go back and forth freely between the brain and the body. What can happen though to you and to me from accidents, from injuries, from posture stress, our jobs, repetitive things, over months and years we can develop distortions like this shows right here. Obviously this picture is different than the top one, and what happens here is that the pressure and stress builds up over time and starts blocking messages and signals that go throughout the body, particularly down into that arm area, and then what it can do is it can predispose us or create weakness that then we develop these problems that just don't want to go away. So in addition to caring for the soft tissues, the muscles and tendons, in addition to checking and addressing problems in the elbow, one thing that we do as chiropractors is we also check, in addition to the joint where the pain is, the spine where those nerves originate from. And that's what chiropractors do, is we detect and correct problems in the body, and when it occurs like this in the spine or elsewhere throughout the body, that's a condition called a subluxation. So that would be important to check for if you're having lingering problems, something that obviously we do here in the clinic and we see a lot of great success. And if you know, this is something that you haven't had success with, just a simple, easy checkup can really reveal or put and shed light if that might be the problem that's happening. Back to you.
Yeah. So that's good. Let's make sure we massage and ice and
Where
of course-
specifically would you massage?
Hey, let's show about everybody right here, Dave.
Okay. Use this
So, yes, sir. So we're talking about this inside of the elbow in today's teaching. So what's very, very helpful is maybe to put some lotion, olive oil, something like that on the skin. And then if you have an assistant, like I'm doing to Dave here, you can just gently stroke through those muscles, maybe push and rub and look for sore spots. And if you find a sore spot, which you probably will, just kind of working that out little by little with short strokes and then also with long strokes. You might also at the same time check the other side. So we have the wrist forearm flexors, which are the muscles here. These on the outside are more of the wrist extensors. So depending on what's going on, where your trouble is, there can be tender spots.
So if you had the tennis elbow, then you'd flip it over and do the same thing
Then
on the
you
other
would
side.
likely, yes, find that there's tenderness
Okay.
here versus the
The golfer's
golfer's side, yep, the medial side,
Okay.
where you can find it there. And then just get in and work it out. And then what's very helpful after you massage is then to take an ice cube, maybe hold it in a washcloth, and then just rub the tender area for a minute or two, numbing it up with that ice massage, and that draws out the inflammation as well and helps with the healing.
Okay.
awesome. Yeah, that's kind of what I wanted to know. That's what I wanted you guys to know. So anyone who is being bothered with this just irritating elbow pain, hopefully you found this helpful. And I think if those things aren't helping, they could come in and see you personally, right? I know there's little cards at the gym right when you walk in the door, specifically for Credence members. They can come here and
Get a
get
fitness check.
started. Yeah.
You bet.
All right. Thanks for watching, you guys.